Now let us talk about the next topic, doctor, that is called thrombus. What is the most common site of the origin of the venous thrombi, doctor? The deep leg veins. What are these dark lines of John that you see in the case of the thrombus? Dark lines of John means there will be a dark line, pale line, then dark line, pale line, then dark line. So a dark line में आपको RBC segregate होता है और pale line के अंदर आपको platelets रहता है. So together they form the line of the John is what you need to remember. So these are all RBCs, doctor. These are all RBCs. और ये pale zone जो है ये सब platelets की वजह से pale zone रहता है, right? So that is what you need to basically remember. So the alternating light and dark bands, the dark bands have abundant RBC, light bands have platelets and fibrin is what you need to remember. So when you look at the microscopic appearance, you have the platelets and fibrin and RBCs are those thicker component is what you have to remember. What type of embolism you see in fracture of long bones? Fat embolism. Kaisan's disease is the air or gas embolism. Decompression sickness or diver's disease. Whenever you dive deep, then the oxygen becomes insoluble and it will bubble out, and that lead to development of the severe hypoxia called decompression sickness is what you need to remember. Kaisan bole to, this is the seabed, doctor. This is the water surface. Seabed ke niche Kaisan, all these drilling guys. ये Kaisan में काम करने वाले को ये decompression sickness होता है, इसलिए Kaisan is not the scientist name. Kaisan is that underwater. What is the commonest site of thrombosis? Venous thrombosis are very common. Then few things you should know. The DVT are slightly more in men, more than 40 years. 50%, typically more than 50% having orthopedic surgical procedures will have thrombus, and 10 to 20% of the idiopathic DVT patients or cancer patients, and 1/3 to 1/4 of the patients having proximal DVT will develop pulmonary embolism, and about 10% of the hospital deaths are because of the pulmonary embolism is what you need to remember.